Hello friends, I'm Dr. Jeevram. I'm going to discuss about the septic abortion or post-abortal sepsis. Septic abortion is serious uterine infection during or shortly before or after an abortion. Septic abortions usually result from induced abortions done by untrained practitioners using non-sterile techniques. They are much more common when induced abortion is illegal. Infection is less common after spontaneous abortion. Typical causative organisms include E. coli, Enterobacter aerogenes, Proteus vulgaris, Hemolactic streptococci, staphylococci, and some anaerobic organisms, Clostridium perfringens. One or more organisms may be involved. Signs and symptoms of post-abortal sepsis. Symptoms and signs of septic abortion typically appear within 24 to 48 hours after abortion and are similar to those of pelvic inflammatory disease. Chills, fever, vaginal discharge, often peritonitis, and often those of threatened or incomplete abortion. Vaginal bleeding, cervical dilation, passage of products of conception. Perforation of the uterus during the abortion typically causes severe abdominal pain. Septic shock may result, causing hypothermia, hypotension, oliguria, and respiratory distress. Sepsis due to C. perfringens may result in thrombocytopenia, ecchymosis, and findings of intravascular hemolysis. Anuria, anemia, jaundice, hemoglobinuria, hemosideриnuria. Diagnosis of septic abortion. Clinical evaluation, cultures to guide antibiotic therapy, ultrasonography. Septic abortion is usually obvious clinically, typically based on finding severe infection in women who are pregnant. Ultrasonography should be done to check for written products of conception as a possible cause. Uterine perforation should be suspected when women have unexplained severe abdominal pain and peritonitis. Ultrasonography is insensitive for perforation. When septic abortion is suspected, aerobic and anaerobic cultures of blood are done to help direct antibiotic therapy. Laboratory tests should include complete blood count with differential liver function tests, electrolyte levels, glucose, blood urea nitrogen, and creatinine. Prothrombin time and partial thromboplastin time are done if liver function test results are abnormal or if women have excessive bleeding. The initial treatment of septic abortion. The uterus may need evacuation, however, parenteral antibiotics must be administered before evacuation. Injection ampicillin IV 1 gram state plus injection metronidazole 500 mg plus injection gentamicin 80 mg state. Patient should continue with the following oral antibiotics after evacuation for 5 to 7 days. The treatment of mild to moderate post-abortal sepsis. Capsule amoxicillin orally 500 mg every 8 hours for 10 days. Plus tablet metronidazole orally 400 mg every 8 hours for 10 days. Plus tablet doxycycline orally 100 mg every 12 hours for 10 days. Treatment of severe post-abortal sepsis. Body temperature higher than 38 centigrade, marked abdominal tenderness are signs of severe post-abortal sepsis. Drug of choice injection benzyl penicillin IV 2 million units every 6 hours. Plus injection chloramphenicol IV 500 mg every 6 hours. Plus injection metronidazole 1 gram twice daily. If patient can swallow, continue with parenteral treatment, give metronidazole 1 gram PR twice daily or IV 500 mg every 8 hours. Choice for parenteral antibiotics, injection ampicillin IV 500 mg every 6 hours. Plus injection gentamicin IM 80 mg every 8 hours. Plus tablet metronidazole or parenteral 1 gram twice daily for the duration of 5 to 7 days.